This summer, I have worked through Self Regional Healthcare of Greenwood, South Carolina as an intern in the physical therapy department. The mission of the hospital and all of its divisions is to improve health by bringing advanced care closer to home. The vision is through our exceptional physicians, inspired staff, and innovative technologies, we will be the leading provider of advanced healthcare services for all communities that we serve. The mission and vision of Self Regional Healthcare. An acronym to describe the hospital is Self-Pride. S is to show respect, E is to effectively communicate, L is to listen, F is to follow through, P is for professionalism, R is to recognize every individual, I is to initiate and inform, D is to do the job right the first time, and E is to expect the best from Self Regional Healthcare. This is the acute care gym in which I worked in for about 50 hours. I would also follow therapists throughout the hospital for when evaluations were done in patients' rooms or either for room calls for therapy. Patients in acute care would generally come down twice a day for therapy during their stay in the hospital. This is a private therapy room for those who needed special care. One stroke patient I observed stayed in this room due to a contagious infection that he had. These are the therapy balls and other therapy equipment that are in the acute care gym. Handrails used to aid in walking when patients come down to the gym were very helpful and used very frequently. Here, a therapist is measuring the range of a knee joint from a knee surgery patient. This is a picture of the Self Regional Healthcare campus. Optimum Life Center, where I worked most of the time, is starred in red. I worked in the Optimum Life Center for about 130 hours in various departments, mostly in physical therapy. This is a picture of the Optimum Life Center, which is an outpatient therapy center. This is the outpatient gym where I spent most of my time during my internship, where I helped the therapists. This is another view of the gym and all the equipment included. This gym had a wide range of different machines and exercise equipment for therapy use. These are the TheraBands that I would cut for patients to take home with them for exercises that needed resistance. The yellow is the tightest, and the colors have decreasing resistance. This is other walking equipment for patients with these needs. I would often get these out and help with steadying patients and help them walking. This is an ice pack freezer that I would prepare the ice packs for patients from. These are gait belts to put around patients' waists in order to keep them steady while walking, and also for safety reasons. Many times I would help support patients who are unbalanced. This is the medicine cabinet for any of the medicinal equipment used, such as electrical stimulation, iontophoresis, which uses prescribed medicines, and deep massaging lotions. This is a picture of the prescribed medicines for iontophoresis. I helped prepare patients for this medication throughout my internship. This is a goniometer, which is used to measure the flexion of joints. I aided therapists by holding this steady while measuring to effectively and efficiently get a correct number to show improvements in their flexion. Here, I am helping a patient into traction. This is a procedure that slightly pulls the back or neck to help realign the spine to release pain. In all of the following pictures, I am being supervised and guided by a licensed physical therapist. Due to the laws and regulations of the hospital, I did not perform any of these treatments alone, but aided as much as I was able. These are the electrodes and electrical stimulation that you attach around a painful area. The impulses and sharing of movement between the electrodes will relieve pain by causing a single muscle or group of muscles to contract. This helps strengthen those muscles and promotes blood supply that assists in healing. Here, I am setting up the electrical stimulation machine for treatment. These electrodes are placed at varying locations to use the appropriate muscle fibers. The same color electrodes should always be diagonal to each other to allow proper stimulation and circulation. I am placing an ice pack on the injury. Ice packs are always enclosed in a pillowcase. I would often place gel on the ultrasound handle to aid in this procedure on patients. Here I am using the ultrasound machine to deeply massage the muscles. Here I am measuring a knee patient's joint flexion with a goniometer to see the progress that her therapy has allowed her. This is a very important part of recovery for knee patients, since it is the only concrete evidence of major improvements. Another part of my internship was to make sure all materials were in their proper places. Here I am replacing all of the ultrasound gels and other materials. Another aspect of my job was to prepare heat packs for patients who needed the warmth for their pain. The temperature of the heat pads can at some points exceed 150 degrees Fahrenheit, so extreme caution is used when removing these pads. There are different types and sizes of these pads when used on different parts of the body. This is a large heating pad used normally on backs. This is a cervical heating pad used for the neck. Here I am layering the pads to be prepared for the patients. At all times there must be 5 layers of towels between the heating pad and the patient's skin. This is done for safety reasons and for the best possible temperature to help muscle or joint pain. Here I am waiting in a back room preparing for surgery. I was able to see a total knee replacement surgery so I could see every aspect of a recovery from beginning until the physical therapy ends. This information I gathered and experienced was included in my case study. In such invasive surgeries like a total knee replacement, total scrubs are used on everyone for safety and complete sterilization. Working with the Optimum Life Center through Self Regional Healthcare has been a great experience for me, and I have gained an immense amount of knowledge about physical therapy as well as how the hospital runs with all of its divisions. With the help of all of the staff and patients, I have grown to love physical therapy, and I am very eager to pursue that as my career.